Myth or fact? Bladder leaks are just a normal part of getting older.
Myth, a terrible myth. Once we get out of diapers, we should be able to stay out of diapers. We have wonderful options that can help you restore your quality of life and keep you dry.
Myth or fact? Having children can increase the risk of bladder problems later in life.
Fact. So whether you are pregnant and have a cesarean section or a vaginal delivery, that does increase the risk of urinary complications down the line.
Myth or fact? Only older women experience overactive bladder.
Myth. So urinary incontinence, urgency, frequency, and the other side, stress incontinence, is common from women age 20 as they age. It does become more common as you age, but about 10 to 20% of patients under 20 years or older do have this disease, and it is treatable.
Myth or fact? Drinking less water can help prevent bladder leaks.
In between, I would say myth. Well, excuse me, I would say fact. Ins equal outs. So the more you drink, the more you will urinate. The problem is with this disease, it is not typically a function of production, urine production. It's an issue of storage. So, our therapies right now are working on the storage, allowing that bladder to hold more urine. So, if you have the ability to hold more urine, you can drink more. But like you mentioned, the more you put in, the more you should put out.
Myth or fact? Pelvic floor physical therapy can help improve bladder control.
Wonderful fact, 100%. So it is our first line therapy for the treatment of overactive bladder and urgency. Highly effective, empowering, no risk. So it's a great, great option to start with.
Myth or fact? Frequent nighttime urination can sometimes be linked to bladder dysfunction.
Fact. However, the interesting thing about nighttime urination is that I just mentioned the difference between storage and production. So sometimes nighttime frequency urgency leakage is associated with storage. So many frequent low volume voids, but sometimes it's a production issue. So we have something called nocturnal polyuria. We make too much urine at night. That can be caused by lower extremity edema, that can be caused by cardiovascular diseases, and very commonly it's associated with sleep apnea. Treating these symptoms can improve those nighttime symptoms.
Myth or fact? Bladder problems only affect physical health.
We're going to call that a myth. It affects everything. So it affects quality of life, depression, happiness, what you have in your pocketbook. It affects your ability to do things you want to do and how you want to do them. The bladder shouldn't chain you to home. The bladder should you should be the boss of your bladder. And again, we have some great technologies to help with that are safe and very effective. That can restore the quality of life.
Myth or fact? Caffeine and alcohol can sometimes irritate the bladder.
The fact. So caffeine is irritated. Caffeine is also a diuretic. So it can increase the amount of urine we're producing. And if we have an issue with storage, that can cause more urgency and frequency. Alcohol similarly can irritate the bladder and also cause some diuretic effects, which can both irritate and increase the production of urine, which causes more of that frequency and urgency.
Myth or fact, menopause can contribute to bladder symptoms.
Fact. So, again, when it comes to how prevalent this disease is, there's a significant jump in this perimenopausal and postmenopausal state, which is why adding back estrogen vaginally does, to some degree, improve some of these symptoms. But there is an a yet undefined true association between the two. So, taking oral hormone replacement therapy, topical hormone replacement therapy does not improve those symptoms, but the vaginal estrogen, topical estrogen does appear.
Myth or fact, if bladder symptoms are mild, there's no reason to mention them to your doctor.
That's a myth. If something is bothersome to you, please mention it to your doctor. Quality of life is important. Being able to do the things that you need to do is what we all should be doing. So if it's as easy as a quick mention and a quick discussion, a visit to a pelvic floor physical therapist, improving fluid management strategies, improving edema at night, improving your sleep apnea. These all of these things can allow you to do the things that you want to do. So, yes, absolutely, patients get to draw that line in the sand about where they are, where they want to be when it comes to bladder health. But I hope that after kind of hearing some of these options, that line comes a little closer. To allow you to know that there's some great options out there. You don't have to wait until it's too bad.